and welcome back to NalaTalk, where we discuss updates on the field of genetic testing, especially its implementation in clinical settings. Today, I are joined by us again as a continuation of what we talked about last week, but today we'll pick up a different use case, and we hope to share some new information to you guys today. Hi, Fad.
Hey, Esther. Nice to be talking to you again.
I know. Yes. Diwali to you all as well. Now, what are we going to talk about today? I thought we'll have a different use case, but one that is still prevalent in the community, and that is the use of PPI atau proton pump inhibitor. Yeah. And then I think later on you can enlighten us as to what PPI is for, but just to get a sense of what PPI is used, I thought I'd just give the people, maybe some of our listeners don't have medical background juga gitu ya. So usually in the community, it's used for gastroesophageal reflux disease. Gitu kalau misalnya ada yang bilang sakit mah gitu ya, atau ada acid problem, that refers to that. Tapi I think sometimes people can only explain the symptoms juga gitu, kayak misalnya, jadi symptomsnya apa sih gastroesophageal reflux disease? So it could be like stomach pain, heartburn. So it's just like this rising sensation of heat and sort of burning feeling in your chest area. There's ada acid regurgitation as well, where you kind of feel like this sour tasting feeling at the back of your throat. Terus ada juga with that gitu ya, you get coughs and hoarseness in the morning. Some people have trouble swallowing gitu. Or some people who I've seen come through emergency department actually get investigated for kayak possible heart attack gitu, because it happens around the same area. So I think we want to be cautious. But yeah, lots of people have these symptoms. And today, we want to pick on two underlying conditions. Yang pertama itu yang gastroesophageal reflux disease. Yang kedua itu peptic ulcer disease, especially in relation to Helicobacter pylori, which is like very difficult to say. It's a very long word. Tapi itu is a name of a bacteria gitu. Nah, mungkin can you sort of explain how PPI is used in those instances where there's like overproduction in acid, or how it impacts sort of in the long term, and why is it important?
Right. Yeah, thanks, Esther. So PPIs, I'm not sure whether most of us know what PPIs are. So PPIs are what we call like mostly if you go to the drugstore or pharmacies, it's omeprazole, esomeprazole, lansoprazole. The brands could be like Nexium and what's it called? The others are usually
generic.
Olmec. Yeah. So usually how PPIs work is they try to suppress the production of acid inside our stomach, but they don't do it directly. So what goes inside our body is usually the deactivated version of it, and then it needs to go in and get absorbed in the gastrointestinal system, in the usus. Dan dari usus itu akan masuk ke bloodstream, and only when in the bloodstream, when it passes through the stomach, it will be there to bind with the gastric secreting cells, and then it will prevent the production of acid inside our body. So it is actually quite potent in terms of like reducing these uncomfortable events when you have like gastric reflux. And usually when you take it like 30 minutes to 1 hour before your food, because it needs some time to be activated before. Yeah, so that's that. So yeah.
No, thanks for explaining how it works. But I think I also want to touch on why do people seek for medication, or why do people get treated for this gitu ya? First of all, obviously, you look at the impact that this symptoms have in your day-to-day activities. Just imagine if you have this ongoing problems gitu, and you try to just get on with your day gitu ya. Jadi it does impact on productivity juga, especially at night, because you lie flat, so your sphincter is more relaxed, and so you get worsening of the symptoms usually at night. So people have trouble sleeping, or they don't have like a good sleep, and obviously that will impact anyone gitu, who are unable to get a good rest, a good restful sleep at night. And also, more importantly, why people are put on these medications. Yang tadi, jadi misalnya, if they have this bacteria causing problems, it can actually create ulceration. Jadi kayak ada this crater and bleeding in your stomach. That can create a whole host of problems. Juga in the long run, misalnya bisa cause for your cells in the lining of stomach, or sort of on the border between your esophagus and your stomach, to change gitu. Jadi it can predispose to cancer gitu. That's why you want to treat it early, you want to catch it. And the other thing would be if you have ulcers, you can have bleeding gitu ya. And if the bleeding is significant, obviously that you need to get rushed into the emergency department gitu. And then we see people with what we call hematemesis and melena gitu. Jadi kayak different manifestations of bleeding from the top and bleeding from the bottom. And they have to be put on PPI juga gitu. But usually IV sih kalau itu, IV preparation. Tapi that's just to give a context of why people, one, need relief from their symptoms, more so in the sort of short-term setting, tapi in the long-term juga to avoid those other downstream consequences kayak gitu. Now, I noted that some people, though, don't get relief from PPI, just in the context of pharmacogenomics gitu ya. What are some of the genetic differences that could attribute to this problem, Mefat?
So that definitely is the case, because the thing is that the PPI needs to be activated and be absorbed inside our bloodstream to be able to exert its effect. It's not like the usual the milk of magnesia or other kind of like acid to neutralize acid neutralizers. It acts and physically. This one actually needs to be activated, and then it will also be deactivated inside our liver. So one of the important enzymes that deactivates these kinds of PPIs are usually what we call CYP2C19. CYP2C19 is mostly present inside our liver, and this activity of this CYP2C19 will dictate how long will this PPI effect will last. Because usually people with the normal metabolizers CYP2C19, the effect of PPIs could last up about 8 to 12 hours. But if they have a higher activity of metabolizers, this effect could be greatly reduced to even not be able to reduce the symptoms. So yeah, CYP2C19. It's also coincidentally the same enzyme that is used to deactivate a lot of other drugs that is usually taken with PPIs, for example, like heart medications as well. So so what we want to look at, right? If we get like acid reflux without any relief, even after taking the PPIs, is we want to take a look at the CYP2C19 metabolic profile, I would say. Yes.
Yeah. And so there are polymorphisms as well in the community in this CYP2C9 gene as well that can impact and the efficacy, or like how effective this drug may be. Yeah. CYP2C19, right?
Yeah.
Did I say CYP2C9?
Yeah, I think it's just a...
Oh, sorry. No, I meant CYP2C19. Sorry, it's still early in the morning. CYP2C19. And I guess especially important because if you have to take this medication for a long time, you really want to pick and choose the right medication. So you get the relief, and two, you can avoid all of those nasty things that we say potentially can happen and have an effective therapy, isn't it? Yeah. For example, with eradication therapy for Helicobacter pylori, I think you do need to be on it for quite a while.
Yeah. Also for Helicobacter pylori, right? They prescribe something called triple therapy or quadruple therapy. So the first line is usually triple therapy with 2 types of antibiotics paired with 1 PPI that's usually taken in a course of about it could be up to 3 months or 12 weeks. So usually the dosing for PPIs for people with the normal metabolizer profile is about just for omeprazole, for example, it's just 20 milligrams or 40 milligrams. But if we look into people with like ultra rapid metabolizers, C2C19, they might need an increased starting daily dose of about even up to 100%, so 80 milligrams and above. So yeah, so it is really the reason why we want to do this is because we want to make sure that the environment, because Helicobacter pylori actually thrives in acidic environment, we want to make sure that the pH inside our gastric or our stomach is sufficiently high enough to be able to reduce the population of these bacteria in our stomach.
Yeah. Right. Yeah, so that's also, I think, important in the Asian population where there's high prevalence of Helicobacter pylori.
Yeah, that's true. Yeah, so prevalence itself, right, in H. pylori in the population in our Asian community, it could go up to about 80%. So, meaning that in a group of 10 people, 8 of them might have Helicobacter pylori infection in their stomach. And this is actually quite interesting because not everyone who have H. pylori will have symptoms of like ulceration in their stomach or in their intestines. But it is recommended that if it's found that we have infection, we need to be able to treat it as soon as possible, because as what Dr. Esther has mentioned, we leaving it there, it could actually increase the chances of developing cancer. So yeah, so we have quite a higher prevalence rate compared to the world. Maybe it's because of a diet, maybe it's because of our genetic makeup. Also, it's just the presence of this bacteria is just more endemic in this geography. Yeah.
Yeah. Wow, that's so interesting to think that, like, say if you have a family members of 5 people, like 4 out of the 5 might actually have this bacteria. But thankfully, none of us, I mean, so far as I know, have this problem. But it's good to know the statistics, isn't it? Because it's quite mind-blowing as well. Okay. So I guess just to sum up, reason why we want to sort of raise this topic is that sort of acid-related acid reflux-related problems are very common in the community. You probably know someone who has that kind of problem in your family or in your circle of friends. And usually, in mild cases, people can just treat it with some sort of home remedy, or it only lasts for a couple of days, so it doesn't cause too much problems. But for some people, they need to go on therapy. Usually the first line is a PPI or a proton pump inhibitor. And it's important to sort of improve the quality of life. And also, if you have peptic ulcer disease, it's or just a long-term sort of acid-related problem, then you need to be more cautious. Definitely seek your doctor for sort of more follow-up and other interventions. But usually, people are put on the PPI therapy for a longer period to prevent the risk of cancer and further ulcerations. But there exists polymorphism actually in the CYP2C19 gene, for which it is important to know which sort of type of metabolizer that you're carrying so that you can get an effective therapy and also get the most, the greatest benefit out of your PPI. Does that sort of sum up what we discussed today?
Perfectly.
Okay, great. No worries. So we hope that helped you today, and we will see you in another episode of NalaTalk, perhaps with a different use case. Thanks all.
Thank you.